Hello, and welcome to this webinar on common issues with data inputs for the Agency for Toxic Substances and Disease Registries, or ATSDR's, Exposure Point Concentration Tool. I'm Dr. David Millard, the Associate Director for Science in ATSDR's Office of Capacity Development and Applied Prevention Science, or OCDAPS for short.
And I'm Dr. Tanya Burke, Associate Director for Science in ATSDR's Office of Community Health Hazard Assessment. Now that the Exposure Point Concentration Tool, or EPC tool as it's also known, has been available for a few years, we want to go over ways to solve common issues you might see with loading your site data into the tool. We've partnered with ERG to develop this training video, so we'll turn it over to them now.
Hi, everyone. My name is Brady Coleman, and I'm an environmental engineer with ERG. As David mentioned, we worked with ATSDR to help develop this training, and I'm going to guide you through it today on behalf of ATSDR. I'll show you how to format data for entry into the EPC tool, and we'll also cover some common issues that users run into when trying to import data. In this training, I will give a brief introductory presentation followed by a live demonstration of loading data and troubleshooting error messages for data import files. Before we start, though, I want to mention that this webinar is not meant to be an introduction to the EPC tool, and that there is a different webinar intended for new users. If you are a new user of the EPC tool, we recommend that you start with the ATSDR EPC Tool webinar instead and return to this one later. The link to that webinar, along with others related to ATSDR's Public Health Assessment process, can be found on the Public Health Assessment Site Tool, or FAST, resources page under the heading PHA Training. With that, I'll move into some introductory information for this webinar. This training covers two topics related to importing data into the EPC tool. By the end of this webinar, you will be able to populate the ATSDR EPC tool data import template with environmental data from your site. We'll use an example lab report to do a step-by-step walkthrough of how to populate the template. You'll also be able to use tools and formulas in Excel to process raw data and troubleshoot common errors thrown by the EPC tool. In particular, the data import issues that we'll be addressing in this webinar are what to enter as concentration values for non-detect records, what to do when you see an error saying that a data import file has more than one unique contaminant name for a chemical abstracts service registry number, or CASRN. We'll also look at the related case of a file with two CASRNs for the same contaminant name. We'll look at what happens when the data import template includes duplicates of information in the sample ID, media, exposure unit, and CASRN fields. And we'll also talk about how to process data and replicate samples before calculating EPCs. Next, I'll provide some reference materials that may be helpful when you're using the EPC tool. Again, we're not getting into the details of exactly how to use the tool or interpret its results today, so you'll need to check out the reference materials on this next slide if you want to learn more about those topics. The ATSDR EPC tool is available to ATSDR staff and its health department partners in the Apple Tree program. It can be accessed through CDC's Secure Access Management Services System, or SAMS, similar to ATSDR's Public Health Assessment Site Tool, or FAST. If you don't currently have access to the EPC tool, you can email fast@cdc.gov to request access. Also, you can go to YouTube and type ATSDR Public Health Assessment Training Web Series to find webinars that describe different aspects of ATSDR's Public Health Assessment, or PHA, process. The YouTube channel contains the previously released webinar on the EPC tool and webinars on other topics, including guidance on public health assessments when polycyclic aromatic hydrocarbons, or PAHs, are involved. There's also a webinar on navigating ATSDR's online Public Health Assessment Guidance Manual, or FAGM, which contains lots of useful information about ATSDR's PHA process and includes links to ATSDR guidance documents that form the basis of the EPC tool. These include ATSDR's EPC guidance for discrete sampling, which identifies the main algorithm used to calculate EPCs, and guidance documents for PAHs and dioxins, both of which include calculations that were implemented in the EPC tool. These documents and others are available on the FAGM resources page under the EPC and exposure calculations heading. We will now move on to the demonstration portion of the webinar so that we can show you how to import data into the tool. We will start the demonstration on the ATSDR EPC Tool homepage. The homepage displays tabs near the top of the page that allow for navigation to the data import, results summary, results details, and resources pages. Below that, the purpose of the tool and instructions for using it to calculate EPCs are described. Near the bottom of the page on the right, there is a link to download the data import template. On the left, there is a button to browse your computer to upload the completed data import template. I'll begin the process of importing our data by clicking the Download Data Import Template button to download the template. I can now access the data import template. The Excel file has 3 tabs at the bottom of the Excel table: Raw Data, README, and List of Fast Contaminants. In the Raw Data tab, I can paste or type in the data we will load into the EPC tool. The README tab contains descriptions of the data entry fields and provides general guidance on using the template. And the List of Fast Contaminants tab has a list of the contaminants that can be imported into FAST along with their CAS-RNs. I'll now navigate to my original data set that I'll transfer over to the data import template. This spreadsheet contains example data in a laboratory report format. In this example, 10 monitoring wells were sampled for 4 different groundwater contaminants: benzene, toluene, ethylbenzene, and total xylene. Results are reported in column E, with non-detects represented by NDs. I'll begin processing the data in my original lab report by copying parts of it into the template. First, I'll copy the sample IDs in column A from the original data set into column H in the template. Next, we need to determine the exposure units for our data. An exposure unit is a geographically defined point or area where a person is expected to contact an environmental medium, such as soil in someone's yard, surface water where people swim, groundwater used for a private well, or air in someone's home. Within the exposure unit, people are assumed to move around or contact the environmental medium of concern. in a manner such that the average concentration of a contaminant is assumed to characterize exposure. Exposure units are largely defined by people's activities and behaviors in relation to where environmental data have been collected. ATSDR's identifying exposure units for the Public Health Assessment Process guidance document has more information about determining exposure units and is available on the resources page of ATSDR's online FAGM. For this demonstration, I'll assume that the data for all 10 monitoring wells listed in the dataset represent the same exposure unit, which I'll call Site 1. So, in the template, I'll assign an exposure unit of Site 1 in column A to all the records. Next, I'll paste the contaminant names in their CAS-RNs into columns B and C. CAS-RNs can be entered with or without dashes. Only one contaminant name is allowed for each CAS-RN, so make sure that each CAS-RN is paired with a unique contaminant name. For example, if CAS-RN 71-43-2 was listed for benzene and also ethylbenzene by mistake, the program would throw an error when you tried to import the data. Similarly, if methylbenzene, a synonym for toluene, was used for some of the results along with toluene, the program would throw an error because there would be one CAS-RN with two chemical names. In the media column of the template, you'll find that there are 6 options you can pick from to identify the medium in which each sample was collected. Options include water, soil sediment, air, food, SVI soil gas, and SVI groundwater. In the last 2 options, SVI stands for soil vapor intrusion. Use those options when entering soil gas or groundwater data associated with soil vapor intrusion investigations. For this demonstration, I'll list water as the only medium associated with our data set. Next, I'll work on getting the results in the original data set prepared to paste into the EPC Tool data import template. In the original data, you'll find that there are multiple non-detects, which are flagged with an ND in column E, which is the result column, and a U in column F, which is the qualifier column. ND and U values are 2 common ways that non-detects are represented in environmental data, but you may see reports where other values are used. In general, you'll need to review your own data carefully to make sure you understand how non-detects are being represented before you move the data into the template. The non-detects from the original data will need to be identified using the detected flag column of the EPC tool template. To generate these values in the template, I'll add a detected flag column in the original laboratory data file and create an if statement that differentiates between detected and non-detected values. In the detected flag column, at the right of the template, you could designate results by hand using 1 to indicate a detected value and 0 to indicate a U or non-detected value. If you have a lot of data, you could also write an if statement that does the same thing, which I'll show you how to do now. In the L2 cell, where I just created a new detected flag column in the original dataset, I'll type the formula equals if open parentheses E2 equals ND in quotations, comma, 0, comma, 1, close parentheses. The first part of the formula, where it says E2 equals ND, checks to see if the data saved in cell E2 contains the letters ND. If the data saved in cell E2 does not, if the data saved in cell E2 contains the letters ND, the formula returns a 0 in the detected flag column. This indicates a non-detect value. If the data saved in cell E2 is anything else, such as a number, the formula returns a 1 in the detected flag column and indicates a detected value. Now, I can click and drag this formula to the bottom of the data set to apply it throughout. This if statement will return 0 for non-detects and 1 for numerical values for the entire data set, based on whether or not each row has an ND recorded in the result column. You can visually inspect the results to confirm that correct designations were made. I'm going to copy-paste these numbers in by value so that the formula results don't change as we keep editing the file. Now we need to obtain the concentrations to load into the template. The EPC tool will throw an error if non-numerical values are used in the concentration column near the center of the spreadsheet, or if any of the values entered are less than or equal to 0. As a result, we need to go through the original data file and replace the NDs in the result column with a positive numerical value before transferring them to the EPC template. For non-detects, you should use the record's reporting limit as the numeric concentration entered into the template. Or if the reporting limit is unknown, you can use the detection limit. Don't substitute 0 for non-detects because that will cause the report to throw an error. Also, you should never use 1/2 the detection limit or any other substitute value because the detection or reporting limit will bias the EPC tool algorithm results incorrectly. In the original laboratory data file, for every non-detect result, I'll manually replace the ND with the corresponding numerical value from the reporting limit column. One more thing I want to point out is that laboratory qualifier designations, such as J values, do not need to be imported into the EPC template, but you should review them to confirm that all the qualified contaminant concentration results are valid. If the files you receive from the laboratory include qualifiers in the same cells as the concentration results, you'll need to remove the qualifiers from those cells, but keep the actual values. Rejected results should not be entered into the EPC template, nor should results for contaminants found in blanks. Lastly, we need to make sure that the units are formatted correctly for import into the template. Examples of concentration units include parts per billion, milligrams per liter, and micrograms per cubic meter. The EPC tool doesn't require a specific format for the units, but only requires that the same unit be entered consistently for contaminant records from the same exposure unit and medium. In our case, the units are all micrograms per liter and are written as UG/L, so there won't be an error. If we enter some of them in a different way, though, for example, by writing out micrograms per liter instead of UG/L, the program would throw an error since the units would not be formatted consistently. Similarly, you should not use the Greek symbol for mu for some units and the letter U for other units, because that will cause the same error. Now that I have processed our data, I can copy our entries from the result units, and detected flag fields in the original data file and paste them into the EPC template. Lastly, I should save and close out of the template before I import it into the EPC tool. I can now navigate back to the EPC tool webpage to run the file through the EPC program. Back on the EPC tool webpage, I'll click the Browse button near the bottom of the webpage to find the ATSDR EPC Tool Data Import Template spreadsheet I just populated and saved. Once I find the file in my folders, I'll click on it and select Open. The Data Import Summary section will populate with summary statistics, and a button labeled Calculate EPC will pop up if no errors are detected in the imported data. Since no errors were detected, I'll click on the blue Calculate EPC button near the bottom of the web page to calculate EPCs for the data we loaded into the template. The web page will automatically switch to the Results Summary tab, which has the results of the EPC calculations. We're not going to get into analyzing these results today, but for guidance on interpreting results after the EPCs are calculated, you should review the EPC guidance for discrete sampling located on the FAGM resource page. You can also check out the ATSDR EPC Tool webinar on the FAGM resource page. Next, we'll explore some common issues with data inputs in the EPC tool using a modified version of the EPC template I just populated. First, I'm going to navigate back to the Data Import tab on the left at the top of the web page. As we just realized, I didn't encounter any errors when I ran the previous data set in the EPC tool. In these next few examples, though, we'll look at some common issues faced by health assessors when importing data to the EPC tool. Also, I'll show you some ways to troubleshoot those issues. First, we'll start off with a simple one, which goes back to what I mentioned earlier about needing to enter positive values in the concentration field near the center of the spreadsheet for each contaminant record. I'm going to upload a modified version of the EPC template we use that purposefully has a 0 entered as a concentration to trigger the error message associated with non-positive data. This mistake happens fairly frequently when users enter a 0 because the contaminant was not detected. I'll click on the Browse button and navigate to the file 0 or negative error example and then open it. An upload error message appears near the bottom of the web page, notifying us that one or more of our concentrations have 0 or negative values. I mentioned this earlier, but for non-detects, reporting limits or detection limits should always be entered instead of zeros. We'll verify this error by checking our data set. In the Excel template, it appears that a 0 is present in cell E15. This appears to be the only 0 listed in the concentration column. This value should instead be replaced with the reporting limit for toluene, which happens to be 1 microgram per liter in this example, based on the original data file. I'll go ahead and replace this 0 with a 1. Now, I'll verify that this fixed the issue by saving the file, closing it, and re-uploading the template to the EPC tool. I'll click on the blue Browse button near the center of the web page, navigate to the file 0 or negative error example, and open it. The modified file is now loaded without triggering any error messages, and you can go ahead and calculate your EPCs. If you happen to get a data set from a laboratory or another source that substitutes zeros for non-detects, reach back out to them and try to obtain reporting limits for the data set. If you can't get reporting limits and are stuck with zeros, you can send an email message to fast@cdc.gov or contact your Associate Director for Science Office. They can give you some ideas on further things to try. If you're an Apple Tree state, contact your ATSDR Technical Project Officer. Next, let's look at some errors that are a bit trickier to resolve. I'll first upload another modified version of the EPC template we created that has some new errors in it. The EPC tool processed the populated template and returned 2 error messages in pink near the center of the web page. The first error message indicates that there are contaminant names that have more than one unique CAS-RN, or vice versa. This is the same issue I mentioned earlier, where, for example, you might have both benzene and ethylbenzene listed as contaminants with a CAS-RN of 71-43-2. The second error message indicates that there is at least one combination of sample ID, media, and exposure unit that has more than one result for the same CAS-RN. In this case, we might have 2 entries for benzene or some other contaminant listed for the same exposure unit and sample ID. We'll need to fix both of these issues in our EPC template to get it to run. I'll go ahead and open up the file so we can track down what's wrong. I'm now in the ATSDR EPC Tool data import template with errors file, which may look similar to the file we populated earlier, but there are some subtle differences. The EPC tool only tells you the type of error in your data set and not which row or rows have the error. So you'll need to go find the rows causing the errors in your file. There are different ways of finding the rows causing the errors, but I'm going to show you a robust way to find them no matter the size of the data set. To check for the first error, which was contaminant names that have more than one unique CAS-RN or vice versa, I'll add a new column in column I of the spreadsheet and title it Key 1. Next, I'll write formulas in this column to create text string keys that will help us identify cases where the contaminant and CAS-RN combinations aren't unique. In cell I2, I'll type equals B2 and symbol, vertical bar in quotations, and C2 to link the contaminant names with their CAS-RNs. The vertical bar or pipe symbol is a delimiter that keeps the contaminant and CAS-RN fields separate within the key. Any delimiter will work, but the vertical bar is a good choice for a delimiter since it doesn't appear very often in environmental data. The vertical bar is located with the backward slash key above the keyboard's enter key. Next, I'll apply this formula to all of the other column I rows in the spreadsheet. Next, I'll create a new tab, which I'll use to check for unique values in these keys. I'll right-click this tab and rename it to something more descriptive than Sheet 1. Let's call it Key 1 Unique Values. In cell A1 of the new tab, I'll write a formula that outputs all unique values in cells I2 to I45 of the raw data tab. The formula is equals unique, open parentheses, raw data, exclamation point, I2 colon I45, close parentheses. This returns all of the unique values in column I, and therefore, all the unique combinations of contaminant and Cas-RN in the imported data file. You may notice that benzene and toluene are listed twice in this relatively simple example. So in this case, it's pretty easy to see what the error is. The word benzene is paired with two different Cas-RNs, 71-43-2 and 71-43-3. So one of those is wrong. You can use FAST to identify the correct Cas-RN for benzene, which is 71-43-2. Also, the Cas-RN 108-88-3 is paired with both toluene and toluene, which looks like a misspelling of toluene. So to fix these errors, we just go back to the EPC template, correct the misspelling of toluene, and fix the wrong benzene Cas-RN. For a much larger data set, it might not be as easy to spot which records have the errors in them. The method I'm about to show you works well if you have a data set with a lot more unique combinations than those in this example, when it's not as easy to find the records with problems. First, I'll highlight these 6 values, copy them, and paste them as values in the same cells. This will prevent the formula values from updating as we continue to modify the spreadsheet. I'll then use the text to columns Excel feature to split each of the unique key 1 values into 2 columns, with the vertical bar acting as the delimiter. While these 6 cells at the top left of the Excel table are highlighted, I'll navigate to the Data tab at the top of the Excel window. While the 6 unique values are still highlighted, I'll click on the white Text to Columns button on the far right side of the tab. Within the pop-up window, I'll leave Delimited selected and click the Next button. On this second pop-up window, I want to make sure all delimiters are unchecked except for Other. Then, I'll type a vertical bar in the field next to Other. Now, I can click the Next button. One issue that sometimes occurs is that Excel will want to turn the Cas-RNs into dates, since Cas-RNs for some contaminants look like dates to Excel. We can deal with that problem ahead of time using this menu. Within this pop-up box under Data Preview, I'll select the second column where the Cas-RNs are listed under General. Then, under column data format, I'll change the selection from general to text to keep Excel from interpreting the CAS-RNs as dates. Lastly, I'll click the Finish button at the right bottom of the screen. This split each entry in column A across the vertical bar within each string. The contaminant names are in column A, and the CAS-RNs are in column B. Next, I'll select cells A1 to A6. Now, I'll navigate to the Home tab at the top left of the Excel menu and click on the Conditional Formatting drop-down menu on the right side of this tab. Under Highlight Cell Rules, I'll want to click Duplicate Values. The duplicated contaminant names will now be highlighted as red text and shaded red. If you are having trouble seeing the text, Excel allows you to select different colors and text to highlight the duplicates. To highlight the duplicates in the CAS-RN column, I can do the same steps but highlight the CAS-RN in column B. Another option is to just paste the formatting from the cells in column A. To paste the formatting, I'll first highlight and copy cells A1 to A6. Now I'll highlight cells B1 to B6. And using the Paste Special feature, I'll paste the formatting only from cells A1 to A6 into B1 to B6. Duplicated values in each column are now highlighted as red text and shaded red. Duplicates in the contaminant name column mean that one of the CAS-RNs listed for them is wrong. Duplicates in the CAS-RN column mean that one of the contaminants listed for them is wrong. This could be a misspelled name or the use of two synonyms for the same chemical. This method works well if you have hundreds of combinations of data with lots of potential errors, and you need a reliable way of quickly identifying the records with issues. To fix these issues, I'll need to go back to the Raw Data tab and find the cells with the incorrect entries. From a quick scan, the record with the wrong CAS-RN for benzene is in cell C22. So I'll go ahead and correct that CAS-RN from 71-43-3 to 71-43-2. Similarly, it looks like toluene was misspelled in cell B31, so I'll quickly change that to toluene. In this case, those were the only two errors, but in a larger file, you might need to spend time filtering and sifting through the records to find the exact rows with the issues. We've now dealt with the first error message that the EPC tool returned, so we next need to deal with the second one, which indicated that there was at least one combination of sample ID, medium, and exposure unit that had more than one record for the same CAS-RN. We'll follow a process similar to the one we used for the last error to deal with this one. In cell J1, I'll title this column Key 2. Next, I'll use a formula to link the data in the exposure unit, CAS-RN, media, and sample ID fields. The formula that I'll enter into cell L2 is equals A2 and vertical bar in quotations and C2 and vertical bar in quotations, and D2, and vertical bar in quotations, and H2. The formula uses the same vertical bar from the previous example as a delimiter for the same reasons as before. In this case, the formula is making a unique key from the values in cells A2, C2, D2, and H2, with a vertical bar in between the values from each cell. The AND symbol joins the different elements of the key together. I'll go ahead and copy the formula to the rest of the rows in column J with data. Next, I'll highlight column J and navigate to the conditional formatting button near the center of the Home tab. I'll again hover over Highlight Cell Rules and click Duplicate Values. Now, all duplicate combinations of exposure units, Kazarens, media, and sample IDs are highlighted and shaded red. From looking at the highlighted values, it appears that data for 4 contaminants collected from well MW-09 were entered twice, because identical entries for the exposure unit, Kazaren, media, and sample ID fields appeared again in the spreadsheet. One set of these should be modified or removed in the EPC template. If I take a closer look at the rows with highlighted key 2 entries, I'll notice that the numerical result values associated with each replicated key 2 entry are not the same. In reality, you'll sometimes see issues like this happen with replicate samples from the same dataset, where one sample was analyzed multiple times for quality control purposes. Occasionally, you'll also see this happen for duplicate samples that aren't clearly labeled as duplicates in the data you get back from the laboratory, or if you're looking at data from reports provided by other agencies. For the purposes of this demonstration, let's say that after discovering this issue, we confirm that one of these sets of data is associated with a duplicate sample from MW-09. The duplicate sample should have had its duplicate status indicated in the sample IDs associated with it, but it appears that step was missed during the data entry process. Typically, you'll want to address duplicate samples before adding data to the EPC template. In our example, we've only discovered this issue due to the error message returned by the EPC tool, so we'll go ahead and deal with it now. To make all the combinations of exposure unit, medium, Kazaren, and sample ID unique, we'll need to combine the parent and duplicate sample results into a single record for each contaminant. Data from duplicate or replicate samples should always be combined into one result for each contaminant before running the EPC calculations, since not doing so will artificially assign greater weight to those records. To reduce paired contaminant records to a single record, health assessors can use either the average or higher of the 2 paired values. For our example, we'll take the average of each paired result. For the averages, I'll copy rows 42 through 45 and paste them into rows 46 through 49. These pasted rows will ultimately contain our averages. Next, I'll select cells E46 to E49. I'll right-click these cells and select Clear Contents. These cells are now blank. Now, I'll enter a formula that will take averages of the paired results for benzene from well MW-09. In cell E46, I'll enter the formula equals average, open parentheses, E34, comma, E42, close parentheses, to take the average of cells E34 and E42. Next, I'll apply this formula to the remaining 3 blank cells by double-clicking on the bottom right corner of cell E46. Next, I'll want to repaste these cells as values only to avoid any data reference issues. While cells E46 to E49 are still selected, I'll copy these results and right-click them. In the pop-up box, I'll click the arrow next to Paste Special, and then select Values under Paste Options. The values are now stored as numbers and not formulas. Now that we have our combined values for each contaminant, we can delete the paired results in rows 34 through 37 and rows 42 through 45. I'll select these rows, right-click the selected cells, and click Delete. Now, none of the cells in our Key 2 column are highlighted, and we have addressed the duplicate sample from MW-09. We should be able to load this Excel file in the EPC tool without any issues. Prior to doing this, I'll save the file and close it. Then I'll navigate back to the EPC tool. Back on the EPC tool webpage, I'll click the blue Browse button near the center of the webpage to find the ATSDR EPC Tool data import template with error spreadsheet I just corrected and saved. Once I find the file, I'll click on it and select Open. The data should now import correctly, and no error messages should be displayed. So that's everything we wanted to cover in the webinar today. If you have any further questions on using the EPC tool data import template or interpreting error messages returned by the tool, feel free to reach out to fast@cdc.gov for assistance. Also, for guidance on interpreting results after EPCs are calculated, you should review the EPC guidance for discrete sampling located on the FAGM resources page. You can also check out the ATSDR EPC Tool webinar on the FAST resources page for more information on using the EPC tool.